My name's Irenie Ekkeshis, and I am a patient, or was a patient, suffering with Acanthamoeba keratitis. This happened about coming on for 5 years ago now, and in that time I've had a pretty bad course of disease. Lots of things have gone wrong with my eye, and it's actually unfortunately left me with permanent vision loss in my right eye. Getting Acanthamoeba keratitis is without doubt the hardest thing that I've ever had to deal with. So as a kind of emotional and physical challenge to me as an individual, it's been the hardest, the most difficult time. As I got the infection and had to start treatment, I couldn't go to work. And it's quite funny actually, because people think, oh, you've got an eye infection, you'll be right in a few days, and it certainly wasn't like that. And I know I hear a lot of other patients say the same thing, that their bosses, their employers, their friends, their family even can't fathom how complex and how painful and how difficult this infection is to treat. So there's definitely a kind of need or a requirement for people to understand the disease better, why it happens, and also to try and stop it. That's partly why I started the No Water campaign. It was as a response to this lack of information and the kind of lack of empathy about what was going on. And I also just felt really strongly that I had to stop this happening to somebody else if I possibly could. And even if that was one person, then that was good enough for me, and I'd have done a good job. In terms of campaigning and running a campaign, it's been difficult but really rewarding. So in February I won the Sheila McKechnie Foundation Health and Social Care Campaigner of the Year. That's given the campaign a big profile and a focus, and lots more people have been interested in it. I've done lots of talks this year as well as a result. In June I was named one of HSJ's patient leaders. I think my biggest thing is to try and take this campaign from being kind of my thing into enabling and facilitating the other patients that want to be involved and that are interested in supporting it to then take the message out themselves.